From 1990 to 2010, HIV has essentially been an adult infection in Pakistan. And the prevalence was high in adult groups who indulged in high risk behavior. And this high risk behavior could have been risky sexual contact, or it could have been intravenous drug users who were sharing needles, or it could have been people who were regular recipients of blood transfusions. For example, the populations who have blood disorders like thalassemics. Children, if they had HIV, were not on the radar. And I think the only children which we on and off encountered were those who were thalassemics and who had blood products. But because HIV screening at that time was not so common, they were off the radar. This is why pediatricians who have trained in the 90s and in the 2000s have actually never read up on HIV, have never felt the need to read up on HIV, because it was not a Pakistani infection in children. What has changed in Pakistan is that in the 1990s and from 1990 to 2010, to date, in fact, till 2025, Pakistan is one of the highest prevalence countries for hepatitis B and C. Now, hepatitis B and C, even though they are sort of labeled as sexually transmitted infections, there's actually a very large proportion of Hep B and Hep C which is spread through blood and unsafe injections in Pakistan. And I've been reviewing the data now for the last 3 decades, and repeatedly, studies coming out of Pakistan have shown that prevalence of Hep B and Hep C keeps rising, despite the fact that there are national programs to take care of the control of hepatitis B and C. A very good vaccine for hepatitis B has been introduced already in EPI and for adults. And in fact, birth dose of hepatitis B has now started in kids just a few years ago. So despite that, and hepatitis C has actually become a treatable disease, very few people with Hep C actually have access to the medicines for Hep C. So with all the lessons which we learned from a rampant Hep B and Hep C epidemic in Pakistan, very much documented that due to poor infection control, due to unsafe injections, due to healthcare infection control breaches, due to unsafe blood, this past decade has been the decade of a rise in HIV spread through horizontal transmission. What does horizontal transmission means? From one person to the other, not through sex, but through unsafe injections, or the sharing of needles, or through unsafe blood, or through dialysis centers and other centers where infection control practices are not being used in the dialysis machines. And so pediatricians have started seeing children with HIV, more and more so. And so it's time now for pediatricians across the country, or general practitioners taking care of children, and especially HIV program physicians, to be aware of how to take care of children. So now, since the 2019 outbreak in Larkana, which actually was not the beginning of HIV in children, but it was sort of the culmination of very poor infection control practices among adults, among children, among women of childbearing age. And now we are seeing this very low-risk group, which is women and children, who have no high-risk behaviors except for the fact that they access healthcare, they get injections, they get blood, they get minor surgeries, for example, which are needed during childbirth, and they've become vulnerable to HIV. So it's important now for pediatricians in Pakistan and for obstetricians and for gynecologists who are taking care of women with childbearing age and beyond to start becoming aware that their clientele may have HIV.